Good morning, Aspen, and happy Saturday. Decided to get a little dressed up for you today because it's been a pretty good week as far as COVID response goes. We are now 7 weeks into this, and I think we can firmly say that we have taken that final step from the response phase into the heart of the relief phase. And recovery, if we do things right, is around the corner. So a handful of things I want to jump into today. The first and foremost is testing. We now have the capability to test every single person who has mild or moderate symptom presentation. That feels nice to say. And those are PCR tests. So those are the nose swab tests that actually tell you if you have the virus, not if you had the virus. Now, the reason that this is possible is a fewfold. One, we have been working for 7 weeks to get tests, so we have more tests available. Secondly, there are less people to test. You did a good job, so there are less cases. Thirdly, we have PPE now, personal protective equipment, that has been on such short national supply, so we are able to perform the test. And lastly, and this one feels really good, we have the healthcare professionals to do it. We had 20 people out of the hospital at one point with symptoms, and now we are down to 5. So for all those reasons, we can go ahead and begin testing everyone with symptoms, and that feels really nice to say. If you are just exhibiting symptoms, call your primary care physician. If you do not have one, you can call the hospital, and we'll make sure you are taken care of, and cost will not be a barrier. Secondly, this week we launched our Aspen Small Business Relief Program that puts $1 million in the pockets of the small businesses that make Aspen Aspen. It is an all-in approach that asks landlords to reduce rent by a third, the city picks up a third, and the business picks up a third, and that's for a 3-month period, April, May, June, or May, June, July. If you are responsible enough to pay your April rent, good behavior will not be punished. You do need to apply for SBA loans, federal grants or loans, to qualify as well, because we are trying to fill the gaps. Our resources are not infinite, and so it's an all-in approach, and it feels really good to help businesses that have been here for decades and are part of the character of our community, as well as just great neighbors and citizens to make sure that they can get through this crisis. So that has been really beautiful. In addition, the Good Neighbor Volunteer Network went live this week. So that's a really exciting thing. It's you go to the City of Aspen website, cityofaspen.com, /COVID-19, click on Good Neighbor, and that is basically a digital marketplace where people who are in need can find people who need to help. If you're a nonprofit, this is a great place to list your services or request dollars. If you are making masks, this is a great way to connect with people who need them. If you need groceries delivered, or you just want a call that says, hey, I'm here for you, you can post that need now. Big shout out to Greg Shaffrin and Leah Fielding of NextGen for putting this together, and the Aspen Community Foundation for getting on board and supporting it, and all of you who helped make this platform better. It's beautiful. And if you are on there using the platform, please send me photos, videos, etc. I'm really trying to start sharing the good work people are doing to inspire others. Lastly, our private donor fund that we have been working to raise in conjunction with Aspen Community Foundation. I am really happy to say 32 people have now donated for a total of $3.8 million. Those dollars will go to help workers throughout our valley, including the undocumented, and it will also go to help businesses and our recovery efforts. So thank you to everyone who gave. We are very, very lucky to be in a community like this. And that leaves us to what's next, the good old Bartlett. And the answer is we have been and we continue to work on a strategy for reopening our economy, our town, and our community. Those answers are not in place yet, but I want to give you a little bit of the background on the thinking there, and the good and the bad that's going on. So we are going to be employing what is called a box it in strategy. We are taking a few elements that we know are necessary, and using them in conjunction with one another. So that looks like testing, it looks like screening, it looks like isolation, it looks like tracing, and it looks like distancing. And in that combination, we will be able to slowly start reopening. Now, this will come in phases. We will open up a little bit over here. Based on the best medical advice, health will come first in all decisions. If you see a decision being made, whether it is about business, construction, parks, or events, know that health has been the number one concern. Okay? So, using all of those things in conjunction, we can make small opening decisions, and then we have to sit back and wait 2 to 6 weeks and see what does the epidemiological data tell us. Is our cases increasing? Are they decreasing? Can we further open, or do we have to go back the other direction? That's the general strategy that is being implemented. Some of the good parts of that, right now an army of tracers is being stood up. The CDC recommends 1 tracer per 1,000 people. We are going to try to do much better than that. And that basically allows us to understand where people are and who they're interacting with. It is simply better to let most people go back to some semblance of real life and isolate and care for those who are sick and are in need. Because if we don't do that tracing and we don't know who they've contacted and we're unable to isolate and treat them, then everyone has to stay at home, which is what we've been doing, which is certainly a worse outcome. So that is in progress, and that is a very good thing. On the bad side of this, our antibody tests that we have those 1,000 antibody tests. Right now they're on the shelf. We had developed a strategy to distribute those, but as we were doing so, we were also validating the test, right? So testing the test. And there does appear to be some form of false positive. So what that means, essentially, when the antibody test works, it's not telling you have the disease, it's not finding it. It's finding the little soldiers in your blood that are fighting it. But there are multiple types of coronavirus. COVID-19 is just a novel or a new coronavirus. There are other coronaviruses out there. The common cold, for example, is a type of coronavirus. And so this test appears to be, to some measure, picking up other coronaviruses. Now, having tests that work most of the time is better than no tests, if we know what that failure rate looks like and what else it could be picking up. But without knowing that, it could actually be more harmful or not helpful at all. And so we are waiting on additional information from the FDA about these tests. Now, before you jump up and down and say, well, why in the world did you buy non-FDA approved tests? Aha, gotcha. A lot of y'all were asking for that back when Telluride was doing a thing. So just, remember that. Everyone was screaming, buy the non-FDA approved tests. And I was actually one of those people. But luckily, our health team is smarter than I am and said, no, we're not going to do that. We're going to wait for FDA approved tests. So the tests that we bought were FDA approved. However, the FDA has created a new expedited process for these tests. Normally, this would take years, not weeks or months. And so that process is new, and it turns out not perfect. There's a reason why this normally takes longer. So those tests were FDA approved, but on further inspection, they're seeing these false positives. And now the FDA is working on further validation, and we're hoping we can still use them, but right now we cannot. The good news is we do have enough PCR tests to know who has this. So that's kind of the good and bad. The governor's order is starting to release things, or relax things, I should say, on the 1st. Picking County's orders will supersede the governor's orders, and we do not yet have those exact orders. So while we do expect some easing of restrictions, We do not yet know what those are, and of course, as soon as we do, you'll be the first to know, and I'll be telling you about it. The last thing I'm going to leave you with is this. I went on a run today, and I stopped in Anderson Park at the Institute and sat on one of those hills in Anderson Park and did my daily meditation. And when I opened my eyes after the meditation and the sort of serene feeling that generally washes you after a meditation, I looked over at the Bucky Fuller Dome that was designed by Buckminster Fuller, futurist and Aspenite, who believed in a collective consciousness and coming together in this millennia. And then I realized the hill that I was sitting on was designed by Herbert Bayer, someone who lived at the intersection of art and design and community and innovation, and looked out over the park at a community that Walter Pepke, or Pepke, it's up to you, envisioned, a place where the best minds would come together from around the world and solve big problems and connect. And it just reminded me that the future is ours to build. We are the designers of this post-COVID universe. It will be different, and whether that different is better or not starts today, and it starts with us. And I believe that firmly. I'm ready for it. There's a lot about that world that we love and cherish and are doing a lot to stand up. As you've heard on this video, there's a lot we didn't like. There's a lot we wanted to change. There was a lot that was imperfect. And this is our opportunity to change all that. So let's not get complacent. If you're feeling down, if you're feeling scared, if you're feeling angry, cool. I have too. And it's warranted. But let's start to channel that anger and that fear into something positive that changes our future. If you're feeling them positive vibes, help inspire others. Everyone's having a hard time. I've taken a pay cut. I'm just lucky to have a job. Many have lost theirs. We're isolated from loved ones. So let's help people find progress together. And to that end, I'm so grateful that we have people in this community like Jess Ewer, Jane Gottlieb, and Gotham. I'm not going to try and pronounce your last name, bro, but it starts with a D and it's long and awesome. Who are jumping right on this and have launched something called We Are the New World. WeAreTheNewWorld.org. There is going to be a first 500-person capped international event this Friday online with some of the leaders in their fields from around the globe, whether it's Hollywood or yoga or wellness or business. There will be people that represent all of those things. And they're going to come together to discuss how we manifest our new world. And there will be breakout working groups with people who are part of it. So I invite you all to join and start thinking about what is the conscious collective future that we want together, because that's what I'll be thinking about, and I look forward to doing it with you. So everybody have a beautiful Saturday. Thank you for spending this time with me. Much love, appreciation, and gratitude.